Friends, I think this talk is most vital talk of the day, and it is very important in today's era when doctors are experiencing a very different kind of stress and intolerance, which was not in the times of Dr. Natekar when they started their career, or at the times of when Dr. Alka Deshpande mentored and taught several who's who of this country. The first and one more thing that I think the reason that this talk is important, if you must have seen, my first assistant started this timer when I entered the stage, and I have already crossed around 1 minute and 44 seconds without even realizing that I have lost around 1.5 minutes of this talk. So we all know that we have born with a timer that the Almighty has given it, and it is running at its own speed without caring that you don't realize that you have that timer in, and we hardly care to see what time has passed. The first disclaimer I would like to put for this talk is, कृपया यहाँ ज्ञान न बाटे, यहाँ पर सभी ज्ञानी है. I am not here to give you some extraordinary knowledge for salvation, or you will get an ultimate realization, but definitely if you give 40 minutes, if you mindfully listen to this talk, it is bound to change your life. I can guarantee that one thing. Why I say that yahan gyan na bate, and why I am saying that I am not here to give some extraordinary knowledge is, गालिब का एक शेर है, ये कहाँ की दोस्ती है कि बने हैं दोस्त नासेह. ये कहाँ की दोस्ती है कि बने हैं दोस्त नासेह, कोई चारा साज होता, कोई गम गुसार होता. नासेह इज सल्लागार, सल्ला देणारा. चारा साज is who walks with a coach, who walks with the person, and gum gusar is somebody who will empathize. So I think probably I might do all these things here. अजून एक शेर मला आठवतोय, मला मोह होतोय तो सांगण्याचा. मुझे सलाह न दे खुदा के लिए, मेरा वजूद ही काफी है मेरी सजा के लिए. म्हणजे खूप सल्ले झाले बाबा, कृपा करून मला सल्ले देऊ नको. माझी अंतरात्मा जी आहे तीच मला भरपूर रोज ही सजा देते. तर आय थिंक दॅट दिस टॉक, हा टॉक जो आहे, इट इज, आय एम हिअर टू जस्ट हेल्प यू टू लिसन टू युअर इनर व्हॉइस. वजूद, आपली अस्मिता, ती जागी करण्यासाठीचा एक छोटासा प्रयत्न कदाचित या टॉकमधून होईल. वॉट एव्हर आय हॅव लर्न्ड इन दिस, आय रिमेंबर अ व्हेरी nice sentence, I think it is by Albert Einstein, that I have seen this world standing on the shoulders of my mentors. So whatever I am going to tell, these are just the pebbles that I have picked up last 30-40 years. जे छोट्या छोट्या गोष्टी ज्या आत्ता मला नाटेकर सरांनी बसल्या बसल्या 1-2 वाक्य सांगितले. उदाहरणार्थ की मी चॅलेंज देतो, नाटेकर सर मला म्हटले, उठताना वर येताना मला म्हटले की मी चॅलेंज देतो अमोल, जगातल्या कुठल्याही माणसाने मला राग आणून दाखवावा आणि माझा अपमान करून दाखवावा. सो दिस इज अ लेसन, दिस इज अ पेबल दॅट आय पिक्ड इट अँड पुट इट इन माय पॉकेट. सो आय थिंक हे या टॉकमधल्या सगळ्या गोष्टी अशा मागच्या कित्येक वर्षांमध्ये भेटलेली जी लोकं आहेत, जी पॉझिटिव्ह लोक आहेत, त्यांच्याकडून शिकलेल्या गोष्टींचा एक हा मला वाटतं एक पुष्पगुच्छ असेल, हा शब्द पुष्पगुच्छ असेल. Friends, medicine is a branch which comes with a huge financial success, fame, name and prosperity. It is a branch where everyone gets enough work, even if you decide. I remember Mumbai University exams were very tough. When the MUHS came, I always say that Maharashtra University of Health Sciences, you have to make an attempt to fail. Till the time that you decide that I have to fail, you are not going to fail. It is same like medicine. Even if you attempt that I don't want to work, still the work is going to come to you. When we start our practice, this is the thing, we hope that our practice should be like Rajdhani Express, where all the darbans will welcome us, will get red carpet daily morning. But this is what we expect the Mumbai local, and what comes actually is this overloaded train daily morning waiting for us. And what happens is, we try to grab totally that we are trying to give. We get the life offers us. We grab everything that is offered in our plate. Moreover, our practice is it is very emotionally burdening, or it is, we never get, we are not running a 5-star hotel where people come to enjoy holidays. Hospital is a place where people don't want to come, meaning actually I feel very bad about one thing, that the anti-incumbency against a doctor who earns well or who is doing well in life or who becomes rich is very high in the society, rather than comparing to a lawyer or any other CA. Even Ramjet Malani, who fought for all the criminals in his lifetime, the anti-incumbency against him is never that high, which is against the richest doctor, because people think that we earn from their sufferings, but it is not that way. Actually, we earn by relieving the sufferings of people, and moreover, people don't realize, we ourselves don't realize that we ourselves are suffering a lot while relieving people's suffering. So I think this is the biggest challenge of our profession, that since morning to night, even if it is your birthday or if it is your marriage anniversary, and if you want to do a counseling of a high risk counseling, you can't show the pleasure on your face. So this is the challenge, that you have to be what you are not, which eats you up every day, emotionally, physically, mentally. So I think medicine profession is somewhere where, while earning your livelihood, it is very challenging to maintain your liveliness. Livelihood is what we earn, आपली भाकरी जी असते ती, what is our bread and butter, and liveliness is the way we are living our life. Moreover, medicine, I think very few professions, or maybe the only one profession, where you have to practice with your body, with your heart, with your mind and with your soul, because you are dealing with life and death. I don't think so any other profession is like this. And in this journey, what happens is, we get into a crisis of what exactly is the joy, pleasure and happiness, and we forget the definitions that we are taught in our psychiatry posting, in joy, pleasure and happiness. I remember I have read this, Dr. Wahiya and all from KEM, Natekar sir must be knowing, or Deshpande madam must be knowing very well, that the things that come momentarily, suppose I am giving a talk and I get a praise, okay, or I win a match. So the momentarily feel good that comes in my mind is joy and pleasure. It is not happiness. It is I think we can go to the neurochemical level. Whatever we get through the dopamine pathway, okay, that is joy and pleasure. But what is happiness is? Happiness is a sustained level of peace, bliss and serenity. It is a sustained, undisturbed, unintentional, effortless level of feel good that we can maintain. I can give a very good example for this. मी काही कोणाच म्हणजे मी त्यांचा काही थेट शिष्य, पण अशी प्रवचनांमधून काहीतरी नवीन कन्सेप्ट्स, तर बेलसरे महाराजांना विचारलं की गोंदवलेकर महाराजांकडे बघितल्यावर किंवा त्यांच्या सान्निध्यात त्यांचं वर्णन तुम्ही कसं कराल, काय होते गोंदवलेकर महाराज. तर प्राध्यापक बेलसरे बाबा ते म्हणतात की दोनच शब्दांमध्ये मी सांगतो, अखंड प्रसन्नता. अखंड प्रसन्नता, अशी प्रसन्नता जी खंडितच होत नाही. तर आय थिंक दिस इज द स्टेज which we can label it as happiness. It is very difficult to define it put it in a medical definition or a textbook definition. So I think this is what we forget, that the aim of our life, or a basic stability that we need in our mind, is this undisturbed peace and bliss. See what happens, a big psychological locha, particularly I don't know how many residents are here. This talk, I think, moreover, this talk is very important for residents who are starting their career. What happens is, over years, when we start working daily in and out, we get huge recognition. Again, medical field is one field where the gap between nobody to somebody is built in a very less time. 1 or 2 years or 3 years, you become a known figure in your place. people respect you, they have fear that you may not treat them in emergencies. So हे सगळं बऱ्याचदा आर्टिफिशियलही असतं. So what happens is we start relating our work with happiness. Yes, definitely it is a source of our happiness, it is a purpose of our life, but mind you, even the big achievers, they will also agree with this, that it is not the only source of happiness. It is one of the sources of happiness, and it is one of the purpose, because you can't keep on working 24/7 and your entire life. At some point it will come. So that's why you must have seen that who are very busy or who are very engaged, even big officers or ex-chief ministers or politicians, when they finish their career, they drop into a very bad mental state, because our society, because we are always told, and this happens very badly with people who have been toppers throughout their entire life, and most of the people in medical field, they have done good in their academic careers till 12th standard. See, the problem is for the person who is always first or who is always doing good. I realized this when I entered KEM. I was first in Maharashtra state with 99.6, 299 marks out of 300 and 590 marks out of 600, and suddenly I failed in my first anatomy exam. So for the topper or the person who is doing good, and everyone is topper, in at least we are toppers in our families, everyone, even the last person in the last medical college is the best person in the family or in the society or in that mohalla at least. So what happens is, for the person, even going to second or third place is seen as a very big calamity. But the person who is between 10th rank to in the middle range, he is never worried, because there is no chance for improvement and no chance for dropping down. So I realized that in KEM I decided that purposefully I will be in that middle range, which won't affect me much. I think, so it is said that it is always good to be a little imperfect. हे जे म्हटलं जातं ते या कंटेक्स्टमध्ये म्हटलं जातं. The second psychological locha that comes is success. When we say that I am successful, he is successful, it is not what we feel. It is usually, success definition comes from endorsement by the society. लोकांना वाटतं की मी सक्सेसफुल आहे, मला वाटतं की मी सक्सेसफुल आहे. I remember a very good definition that Dr. Y.K. Ambedkar, Dr. Yashwant Ambedkar, pediatrics, madam must be knowing very well, he tells in the conference that success is the unintentional side effect of your work that you do for someone other than yourself. Excellent definition. So what happens is, relating work with happiness and relating the definition of success with endorsement of the society, we start losing these three things: length of life, breadth of life, and depth of life. Length of life obviously comes, I am talking about longevity, health and fitness. Breadth of life, work and achievement. And when our health and fitness goes, obviously it affects our work. And lastly, very important, depth of happiness, म्हणजे आपल्या आयुष्याची खोली. So it doesn't come from work. पु ल देशपांडेंनी खूप छान म्हटलंय की तुम्हाला तुमचा व्यवसाय ही तुम्हाला भाकरी देईल, पण तुमचा छंद हे तुम्हाला तुमच्या जगण्याचं कारण देईल, ऊर्जा देईल, उर्मी देईल. सो आय थिंक पु ल देशपांडे इज टॉकिंग अबाउट दिस डेप्थ ऑफ लाईफ. सो आय थिंक what I wish to talk in next few minutes is how to sustain or maintain this length, breadth and depth, and as much as possible try to preserve our body, mind and soul. Am I saying, when I am saying this, am I saying that stop working? Absolutely not. We are karma yogis. We are born in the land of Bharat, where Krishna has taught us karma yoga. We are so big and legendary karma yogis are sitting with us today. So I think I in my practice or while running my institutes, I try to follow this focus funnel. It is very simple. I will explain it. It is a topic for a separate talk, but I'll explain in just a half minute. Just see from morning till night. Just try to record your task on any day and see first thing whether you can eliminate it, whether it is needed. खरंच गरजेचं आहे का हे करणं? Yes, it can be. See, you might feel yes, गरजेचं आहे. Okay. Can it be automated? Infantile colic, my routine OPD, it's the same prescription. Patient and the mother enters, I know it is infantile colic. So what I can do is, I can automate the prescription of infantile colic. Why not? It is the same. Okay. Pediatric OPD, I think how many pediatricians are 10, 15 typical scenarios which are almost the same. Yes, definitely I will confirm that it is infantile colic. Whether it can be automated. Third, if it can't be automated, can it be delegated? Can in my team, or do I have someone who is better than me or who will rise to the occasion and can do it better than me or equal to me? Or even if it is imperfect, it is okay, no problem, it will improve. And it is my experience, we feel that we are better. It is not the case. When I have recruited people in my hospital or in my firm, in my institutes, I have realized that they are better than me. आपल्याबद्दल गैरसमज असतात. Now people ask me in my hospital की सर तुम्ही कॉलेज तुमच्या लेक्चरला बाहेर कधी जाणार आहे? म्हणजे I have understood that the more I am outside they are functioning well. म्हणजे आपल्यामुळे थोडा खोळंब होतोय, आपण त्यांना मोकळं सोडावं हे कळायला थोडासा वेळ जातो. So and this happens with perfectionists, and our problem is that doctors, as a doctors, we feel that we are perfect, but we have to accept that we can't do everything. प्रत्येक गोष्ट आपण कशी करू शकू? So I think delegation is very important, and after that whatever is left, it is that we can do. And believe me, and in 8-10 days you practice this, you will realize there are very few things that are left for you. Let us come to the basics of body. Let us go from body, mind and soul. First start with body, because that is the basic building block. So these are the 5, 6, 7 things that are very important: exercise, sleep, nutrition and emotional being. Rather other things are there for your soul and heart. I always wonder, why do we think that only people who are in glamorous professions like film stars or politicians or whoever, like who are public figures, only they have to maintain a good physique? Looks are okay, looks is a very subjective thing, but at least I will tell that good physique. A few years back I went to JW Marriott for some conference, and I saw Amitabh Bachchan walking in the gym morning 7:30. अमिताभची एकट्याचीच गरज आहे का असं आपल्याला वाटतं की फक्त ह्या स्टार्सलाच ही गरज आहे? आय थिंक it is equally important for every one of us, and believe me, our work is more, I'm not saying that their work is not important, everyone's work is important, but our work is more important for humanity. And I feel that maintaining a good physique or maintaining everything, I was very happy to see Dr. Natekar. I got a huge energy from him since morning I am talking to him. So Dr. Natekar is equally important for this humanity as Amitabh Bachchan is, and so I think we should learn from them. I think every year, every birthday, see we write, meaning we talk about this in conferences everywhere. I wonder why we don't look to ourselves about this. I don't know, if I think Bharati Medicine Department, they should do a survey about all these things in medicos first, and then we can go to other population. So these are the parameters that I think we should check every birthday. Check your BMI, whether it is crossing 24, 25. Check your ideal weight. Check your waist circumference. Check your waist. When was the last time that you checked your waist to hip circumference? I think you check your income tax returns, your bank account, whether you have received salary, but boss, this is the main account that is going to help you for your lifelong. And this is the thing that is giving you that bank account and that earnings and everything. So I think these are the things that you should check for yourself and your partner every year. The day you realize that you are grown 1 year old. This is the biggest crisis that I think first medical field is facing. Doctors are facing. We all know, we are from medicine department. I won't go into the academic details. Sarcopenia, which is loss of muscle mass that we suffer every 3 to 5% every decade after 30 years. The biggest risk factor for sarcopenia is sitting at one place. What happens is we start our busy OPDs, we sit for long hours, and that becomes the biggest threat. We start losing our muscle mass at a faster rate than the general population. I think it is 3 to 5% for the general population. It might be 5 to 10% for medicos. So I think the first thing that we need is working out of at least of all muscle groups at least 3 times a week. Coming to exercise, this is Rakesh Jhunjhunwala. You must be knowing him, the big bull of share market who passed away last year. I read his interview and he met, you must have seen that photo, that Rakesh Jhunjhunwala sitting in a wheelchair and Narendra Modi standing next to him and talking to him. So Rakesh Jhunjhunwala said that I have earned he was a multi-billionaire, millionaire, the biggest bull in market in last 30-40 years. He said that I repent that I have earned a lot, but I never looked to my health, and I advise everyone to note this thing. So I think half hour a day, just from 24 hours, we give around 10 hours to the society, to our patient. I think half hour a day we have to spare for ourselves and exercise. What is the commonest thing that we excuse, that we tell? वेळ मिळत नाही, we don't get time. Boss, the people who will not exercise and who don't get time will have enough time for their illnesses. They will have enough time when they will be in hospital or in the hospital bed. So we don't want that. And I think most important thing we should understand, that business done at the cost of your health is a bad economy. Very simple. Which economy is good? Which will come at the cost of your life? So I think, and most important, try to understand that if you die due to your physical health that you have sacrificed for your patients, will your patients become orphan? No, your family becomes orphan. Believe me that the day you are not there in this world, the very next day, all your patients will change their physician, change their pediatrician, change their doctor. It won't affect them. So I think one dictum that my exercise mentor has told me, that Amol, no exercise, no food. ज्या दिवशी व्यायाम नाही त्या दिवशी जेवायचं नाही, काही फरक पडत नाही. उलट it helps, the fasting will help you in a better way if you are not exercising on that day. Why we don't do this thing? आपल्याला हे माहित नाही का, आपण मेडिकोज आहोत, आपण लिहितो, ते लिहून आपण पास झालोय, आपण डिग्री घेतली आहे, आपल्याला टॉपर गोल्ड मेडल घेतलंय. So why we don't do this? I think first thing is we don't have consistency and continuity in practice. We are आरंभशूर. कित्येक लोकांनी तुमच्यापैकी व्यायाम सुरू केला, पळणं सुरू केलं, धावणं सुरू केलं, चालणं सुरू केलं, बट दॅट हॅबिट गोज ऑफ इन फ्यू डेज बिकॉज वी फील. आपण आपल्या क्लिनिकला जाणं थांबवतो का? डिपार्टमेंटला येणं थांबवतो का? नाही थांबवत. बिकॉज वी डोंट फील दॅट इट इज इम्पॉर्टंट फॉर अस, अँड विच इज कन्व्हिक्शन. वी आर कन्व्हिन्स्ड बट वी डोंट हॅव कन्व्हिक्शन. What is conviction? Conviction, I'll meaning to tell about conviction. I think I have only one story, and that is Mahatma Gandhi. He had a conviction, पूर्ण स्वराज. ते कपडे घालून तो म्हातारा गेला तिथे, आणि I am convinced, I have conviction in front of that Queen Elizabeth. So I think that conviction, what all these people, we should at least have for ourselves. Commitment. We are not committed to ourselves. We are committed to our patient, we are committed to our department, we are committed to our CA, we are committed to everyone, but we are not committed to ourselves. I think being committed to ourselves is respecting our own selves, and we should do that. Conscience is what I was telling about our inner self or the inner voice. I think our inner voice is not strong enough, and that connect is also lost because we lose that length, breadth and depth of our life. So I think I won't go into much detail, but I will tell what I try to follow is a customized. You all are physicians, so you are Hiremat sir will tell in a better way about that. So a customized tailor-made exercise program that will match your age, your health needs, your disease profile and your family history. Suppose you have a very strong family history for heart disease, whatever it can be. So 3 days of workout for 15 to 20 minutes. Remember, my exercise mentor, Dr. Kanse sir, he is Dr. Chandrakant Kanse. I don't know how many of you know him. He practices in Pune. And he has a homeopathy college at Alefata and a rehabilitation center. I found a very knowledgeable person, and you can select your own mentor. That is not an issue. We have a lot of knowledgeable people. We are from medical field. So he told me that, Amol, we have to exercise till the last day of our life, 80, 85 or whatever. So 15 to 20 minutes of weight training workout is enough. Even for your residents, I think you keep some weights in your wards. Why not? When you are sitting and just chit chatting, just 10-15 minutes is enough. So 3 days out of 3 days weight training, 2 days cardio. It can be anything. It can be swimming, cycling, walking, running, anything. 1 day of sports activity, any sports activity that you like, and 1 day of break in your exercise program. This break is also very important. So I told my exercise mentor, doctor, I thank him for giving me realization about he himself was a severe diabetes, and he came out of that on his own through lifestyle modification. Nutrition, again, very simple things. Again, I won't go into details, but very simple things, basic principles, only 3 things. Avoid the worst, 0 sugar. The day you turn 35, आता तरी ठीक आहे, शक्य झालं तर आता, try to leave sugar. We get enough sugar throughout our day. We keep on munching in between. So try to, and believe me, if you leave sugar, you won't like tea or coffee with sugar. Avoid the worst, so 0 sugar, no canned food. This is very important. No canned food, bakery products. Eat the essentials, natural proteins and fats. Minimize the problematic carbs, meal frequencies and drugs. See, a very common meaning for you, medicos, it is very common. सकाळी उठलं, काही वाटलं, थोडं वाटलं की pan-40, pantoprazole. I think the highest consumption of proton pump inhibitors and all these antacids must be coming from medical field, and the 50% must be coming from general population, because we know, we have it in my pocket. माझ्या गाडीमध्ये कधी कॉम्बिफ्लेम आणि हे ते असे ढिगारांनी आपल्या गाड्यांमध्ये आणि खिशामध्ये आणि बॅगेमध्ये पडलेले असतात. काही झालं की I meaning, so these habits come because we know we have the solutions in our hand. So I think this is one thing that we should follow. Very simple, no food. Again, about commitment, I want to tell about this, a very funny and very nice example that should be followed. Try to have no food after 7 or maximum 8. शंकर महाराजांच्या मंदिरात दर्शनाला आम्ही गेलो, तिथे ती खिचडी प्रसाद म्हणून मिळाली 7:30 वाजता. So we all 4, we had khichdi on the way. So I was getting this urge to have Akka Masoor at Shivraj Dhaba, but I controlled myself because I had crossed 8 o'clock. So I think we need to practice these small controls from a very early age in our life. Intermittent fasting is the new trend. So 8 to 8, last meal maybe not 7 but 8, and the first meal next day probably at 8. So it becomes a 12 hours fasting. So coming back to this commitment or conviction, I remember one example that Girish Bapat told me from Pune. Suresh Dada Jain, ex-minister, let us forget the negative things, his Gharkul Ghotala and all, let us not talk about that. But his good habit, in the cabinet meeting, if it was 6 o'clock, he is a Jain, so he followed that Jain tradition of no Ratri Bhojan and Vyalu, what they practice in Jain philosophy. And it meaning Bhagwan Mahavir, and they have told intermittent fasting and all these thousands of years before. So even if there was a cabinet meeting, he used to sit there with his dish and food and used to eat while the cabinet meeting and important decisions were going on. And if somebody interrupted him, Vilasarao Deshmukh and all they were chief minister, he said that hell with your cabinet and hell with your all the decisions. This is my time, 6:30, I am not going to have anything. I am ready to, what is the problem you all have if I eat and talk to you? So I think this is the commitment, this is the level of commitment that we should have for our health and our nutrition. Most important and most neglected thing, sleep. I personally have suffered very badly in KEM. There, when we finished our internship, that we were studying for our entrance exams. So there is a trend in KEM that you study the whole night. 5 o'clock there is a hotel called Milan. So you have poha in Milan and you sleep at 6 o'clock. I don't know from where all these trends have come. I followed that for almost 2.5 years of my life, and I fired my GI so badly. That has come from that 2 years, and what I got out of that is MD pediatrics, which anyway I would have got, even if I would have studied in day, but nobody told me that. So I think these are the fancy things that we follow in our medical life, and that is okay, chalo, 6 months and all. After that also, we get into that habit that even if we don't have patients, or we will see Netflix or anything, and we will just continue with that habit. So I think sleep is the best meditation, what Dalai Lama said. Few important things about sleep. The font is very small, but I will read it out because I added some points in the morning. I think it is in sleep we get healed, recovered and rejuvenate. Average sleep deficit in medico, this is data from a psychiatry journal, in a doctor's life is 30 to 40%. A very huge deficit. I think this is the grassroots problem of all the, I think lot of recent deaths sudden deaths we are listening, many things in news, marathon deaths. I think maybe this is because of the sleep deficit. The best time to sleep is 10 to 7. Between 10 to 12, if you sleep in 1 hour, you get 2 hours of rest for your heart, mind, soul, everything. Between 12 to 5, 1 hour is equal to 1 hour of sleep. So between 10 to 12, you sleep for 4 hours. I think this can be a very good strategies for your residents, that you break for these 2 hours or 3 hours. I know that there is huge workload, and from morning 4 to 6 a.m. in 1 hour we get half hour of rest. After 6 a.m. it is as good as no rest. So I think for multitaskers, sleeping between 10 to 4 is very important. No screen after 7, no dining table storms. This is very important. For meaning, I should not say, both for male and females. नेमकं ते घरी गेलं 7, 8, 9 वाजता की तेव्हाच गोंधळ वाद, कारण आपल्याला डॉक्टर्सला वेळच मिळत नाही. सो आय थिंक वी शुड also block some times for talking these things also. No dining table discussions, मतभेद. तेव्हा रात्री 7-8 नंतर जर आपण त्या मतभेदाच्या चर्चा जर करत बसलो तरी it affects our sleep. Afternoon 3 to 4 p.m. I think for every medico 20 to 30 minutes of a dosing of a power nap is a must. I think get into this habit. Stop your OPDs, everything. I sleep in afternoon daily. मला कधी त्याची लाज नाही वाटली. मी माझ्या सगळ्या पेशंट्सला सगळ्यांना माहिती आहे की 3 ते 3:30 किंवा 4 ते 4:30 दुपारची वेळ फोन सायलेंट करून हे डॉक्टर झोपतात, आणि हे मी डंके की चोट पे सगळ्यांना सांगतो. अँड वेन माय पेशंट स्क्रिप अबाउट दॅट, आय टेल देम दॅट आय एम स्लीपिंग 20 minutes and 30 minutes फॉर युअर चाइल्ड्स हेल्थ, फॉर युअर चाइल्ड्स बेनिफिट. मला एक पेशंट की सर एवढे पेशंट बसले तुम्ही झोपता राव. आय टोल्ड हिम तुम्ही झोपा काढू लागले, आमचे मुलं इथे रडतायत. सो आय टोल्ड दॅट आय स्लेप्ट फॉर युअर चाइल्ड, not for me. Now I am in a better condition to treat you. So I think teach your patients that we have to respect ourselves, respect our time. The day you cannot, very important thing, the day you cannot sleep because you are of your practice for a single day, it is time to take an assistant. BA, MS, BHMS जसा जमेल तसा माणूस घ्या, ट्रेन करा, त्याला मेंटरिंग करा, MBBS घेण्याचा प्रयत्न करा, MD घेण्याचा प्रयत्न करा, whatever, but have an assistant for the night. Okay. Maintain sleep hygiene. Try to have no phone 2 hours before your sleep because it inhibits the bright light of screen, inhibits melatonin. Sunlight is something that we miss a lot in our life. So I will advise that have the morning tea. I enjoyed very nice sunlight this morning at 7 o'clock in the gallery of our guest house, that D building. So just have your tea with your partner in the morning in sunlight. घरामध्ये डायनिंग टेबलवर चहा घेऊ नका, छतावरती जा, गॅलरीमध्ये जा. Okay, so because it will help to maintain just 10 minutes, 5-7 minutes of sunlight exposed to most portions of your body will help to maintain your mood, improve your sleep, immunity. This is most important part. I am coming to the last part, emotional well-being. What happens is we gradually we are tuned to live either in the past or in the future. असं झालं तसं झालं. मला स्वतःला मेडिसिन करायचं होतं. बघा आजही माझ्या मनातून ते जात नाही. I was a medicine candidate, I was a medicine topper, I was that Chetan Bhatt's classes student, madam knows, sir, madam student. सो सगळे प्रयत्न करून मेडिसिनमध्ये पहिला आलो मुंबई युनिव्हर्सिटी आणि एंट्रन्स लागली. एंट्रन्स लागली, रँकच आला नाही. 3-4 वर्ष गेले, 32-35 परीक्षा दिल्या, मणिपाल सगळं. शेवटी MD पिडियाट्रिक्स घ्यायला लागलं. आजही म्हणजे सगळं म्हणजे काय, मला आजही ती भावना कधी कधी की भगवान का दिया हुआ है सब कुछ है लेकिन MD मेडिसिन नाही आहे यार. मग अजूनही ते तर ही फिलिंग अशी का वाटतं आपल्याला, हे मनातून जातच नाही. सो वी ट्राय टू लिव्ह इन द पास्ट. नो यूज. काय मेडिसिन आणि पिडियाट्रिक्स करून असं वेगळं काय झालं असतं, फार काही झालं असतं असं मला वाटत नाही. ऑर द फ्युचर, असं करायचंय तसं करायचंय, पुढे आता हे झालं, माझं आयुर्वेद झालं, नर्सिंग झालं, आता होमिओपॅथीला सध्या एकनाथ शिंदेकडच्या टेबलवर माझी फाईल आहे उपसचिवांकडे. मग ती तिथून हल्ली असेल का, मग ती गेली असेल का, मग ते सही देतील का, मग काय होईल, पुढचं कुठलं कॉलेज, असं झालं. सो फ्युचर ऑर पास्ट, आज आत्ता या क्षणाला, दिस मोमेंट. This happens very rarely. And so what happens is, we can't sit and look back and enjoy, or sit and enjoy the present moment. So again coming back to the same thing, प्रसन्न वाटणं आणि प्रसन्न राहणं. Feeling happy and being happy, totally different. Feeling happy, very easy. You praise me, छान बोललं, feel happy. Being happy, इथून गेल्यावर काय, रोज रोज थोडी सगळे सांगलीचे सगळे मेडिसिन डिपार्टमेंट मला म्हणणारे खूप छान म्हणून. दॅट डझंट हॅपन. सो आय थिंक अगेन द सेम, दॅट अखंड प्रसन्नता. सो द मोस्ट इफेक्टिव्ह वे फॉर दिस इज माइंडफुलनेस. बट अगेन माइंडफुलनेस, अगेन माइंड यू माइंडफुलनेस इज अ वे टू प्रसन्न वाटण्याचा मार्ग आहे, प्रसन्न राहण्याचा मार्ग परत नाही. But still it is important. Let me come to the part. We all know this long circuit and short circuit of our brain. Whenever we were traditional hunters. So when we were in our early life, म्हणजे आपल्या मागच्या पिढ्यांमध्ये आपण आदिमानव जेव्हा होतो, that time amygdala was the strong part, because we were human brain was trained to receive danger signals. But even now also amygdala continue to be the strong. When we get signal, the signals travel from the occipital cortex, they are processed through this short thinking circuit and comes to amygdala, and we get a fight and flight response. अचानक आपल्याला राग येतो, कोणीतरी म्हणजे बऱ्याचदा आता अजूनही त्या आमचं एक मोठं हॉस्पिटल आहे, तरी सगळ्या जनरल प्रॅक्टिशनरचे चिठ्ठ्या, रेफर टू प्रवरा, रेफर टू GMC, रेफर टू, अरे बाबा सगळं फुकट होतं, योजना आहे का नाही आधी राग यायचा, ती चिठ्ठी बघून असं उकळायला होतं आपल्याला की अरे काय बाबा माझं काय वाकडं केलं, मी काय वाकडं केलं तुझं. बट ऑल दिस इज हॅपन्स विथ ॲट लेवल ऑफ amygdala. बट वेन वी practice mindfulness, prefrontal cortex is it happened with me. Our chief minister relief fund, my person called me that CM fund relief is suddenly discontinued. Now my close friend is sitting there as the head, who is my 20 years friend. So I felt की अरे मित्र बसलाय तरी पण माझं कसं काय झालं. But then I realized अरे ठीक आहे मित्र असेल शांत. So this is the response that you get in seconds, and for that we need 6 seconds break, 6 seconds pause. In 6 seconds the amygdala hijack, amygdala storm settles down, and your prefrontal brain, prefrontal cortex, it takes over, which is the thinking and the rational brain. So I think this is what mindfulness help, and the 6 seconds pause or the 6 seconds break helps you. Gurdjieff, a very great thinker of all times, the centuries, Gurdjieff, you must have heard his name. So when his father was dying, Gurdjieff was 9 years old, and Gurdjieff's father told him that son, I am dying, I want to tell you, just I don't have any inherited property for you, I just want to tell you one advice. And that advice was, whenever you have some emotional storm, whenever you are angry with someone or any negative emotion, just wait for 24 hours before you respond to that person. 24 तास आपल्यासाठी खूपच आहे, 6 सेकंद तर पाळूया. सो 20 minutes of mindfulness will change your brain, 25% of your brain in just 8 weeks. So you don't have time, just 8 weeks of 20 minutes practice in a year is also enough for you. बघा 20 मिनिटं रोज 8 आठवडे 1 वर्षातून. I think even that ideally daily will be best. One more thing again, as I told, that prasanna vatna, that momentarily response, amygdala hijack, that can be managed with mindfulness. But prasanna rahana, it won't help. It won't help, and research has also proved this. So for that I will advise you that study rational emotional behavior therapy. It is very important tool for every medico, and if you don't get anyone to teach, just read these two books. One is by Dr. Shrikant Surgade, one of my mentors from Nagpur. Mind Programming, this is translation of Albert Ellis, an excellent book, Me Albert Ellis, by Dr. Anjali Joshi. Dr. Anand Nadkarni takes classes every Saturday, Sunday, every year for 8 weekends. It's a beautiful course that every medico should attend, even non-medico can attend it. Moderation, I think, is one thing that at least our generation, we are going to extremes. मॅरेथॉन धावतायत तर लोक मॅरेथॉन धावतच सुटतायत, मग मरो जगो काय. I think no, that is not going to work. In everything we should have moderation. Every one of us should try to find a spiritual guru, to find even people like Indira Gandhi. कृष्णाचं तर आपल्याला, अर्जुनाचं तर माहितीच आहे खूप, पण ते उदाहरण खूप आयडियलिस्टिक. Meaning Indira Gandhi had J. Krishnamurti as her guru, and in her last 4 years he helped her to pass through that storm after that Operation Blue Star. When we all have these in things eating our soul, eating our heart, की असं माझ्यासोबतच का, मलाच का फसवलं. बऱ्याचदा एखादा पेशंट असतो, आपण त्याला खूप मदत करतो, हे आमच्यासोबत झालंय, आमच्या फॅमिलीचे खूप क्लोज पेशंट, आणि नेमके त्यांचेच रिलेटिव्ह काहीतरी हॉस्पिटलवर हल्ला करतात. मी वाचवलेले एक निओनेट, 2 निओनेट होते, बरे झाले, त्याचा इश्यूही नव्हता, तर दे फाइल्ड अ लिटिगेशन अगेन्स्ट आवर हॉस्पिटल. सो वी फील व्हेरी बॅड की अरे असं का, इतकं चांगलं वागून, इतकं चांगलं राहून असं का होतं, माझ्यासोबतच असं का. सो आय थिंक दिस, इफ यू वॉन्ट आन्सर टू दिस क्वेश्चन, ए व्हेरी स्मॉल बुक, कन्साइज बुक गिफ्टेड टू मी बाय डॉक्टर राधा संगमनेरकर अँड मुकुंद संगमनेरकर ऑफ पुणे, कर्माचा सिद्धांत बाय हिराबाई ठक्कर. इट इज अवेलेबल इन इंग्लिश, गुजराती. एव्हरी वन ऑफ यू प्लीज रीड दिस बुक. Bhagavad Gita, obviously, if you don't get any guru, Bhagavad Gita, I had interviewed E. Sridharan, who told me that there is not a single day that I don't read 1 page of Bhagavad Gita. Self-compassion is very important, friends. We think that we are Rajnikant, but it is not like that. Sometimes we have to accept our imperfections. Please try to avoid accidents, night traveling, addictions. These are the 2 great medicos that we have lost due to accident and addictions. I think you must have recognized them. And lastly, our families are our biggest priorities because they absorb all our vulnerabilities. With all these things, lastly, I will finish my talk with serenity prayer. God, grant me the serenity to accept the things I cannot change. ज्या गोष्टी मी बदलूच शकत नाही, त्या स्वीकारण्याची शक्ती मला दे. द करेज टू चेंज द थिंग्स आय कॅन. ज्या गोष्टी मी बदलू शकतो ते बदलण्याचं धैर्य मला दे. अँड द विजडम टू नो द डिफरन्स. आणि जे बदलू शकत नाही आणि जे बदलू शकतो यांच्यातला फरक समजून घेण्याचं शहाणपण मला दे. थँक्यू व्हेरी मच फ्रेंड्स. जय हिंद, जय महाराष्ट्र.